What exactly to expect from a crown area transplant? So which is the crown area? This is the crown area. So we can roughly divide the scalp with our four fingers. This is the frontal scalp, this is the mid scalp, and this is the crown area or the vertex area. Both are the same. Hair transplant in the crown area is slightly different from the conventional transplant. Why? Because we need to take a call on the number of grafts that will go into that area, because that is not the case. The crown area is a convex area, reflects light, so how much ever grafts you are going to use in that area, you will always feel like it's not enough. Or some patients even have that thing in their mind that crown area transplant don't work, but that is not the case. We always focus on the frontal area, and in the frontal area you would always have to use the hair from the scalp. It's not possible to use your beard hair or your body hair in the frontal area, whereas in crown area you can mix your body hair, your beard hair with your scalp hair and use it in that area. Now if somebody is coming for the first time and they are requesting to fill the crown completely, so it's not a very good idea to use or consume, say suppose more than 2000 grafts or something in that crown area to fill it, because if that person is going to develop baldness in the frontal area, then where are you going to take the grafts from if you've already consumed the donor area? So from a donor area, roughly in a lifetime, you can take around 6000 or 7000, or maximum if somebody is having a very good density, say 8000 grafts in a lifetime. So in the crown area, your expectations have to be realistic. It is a coverage we are looking at, looking into, and it is not your density which we are focusing on in the crown area. If we give a good density in the crown area, definitely the hair would grow there and the crown area would be filled, but there is always a limitation of grafts, considering that we have to use them for the frontal area also. Hence crown area behaves a little differently than the frontal area, and here coverage is important and not giving an ultimate density is important for the crown area. Also, the direction of the hair in the crown area is in a roll pattern. For most of the people, it's like a single roll, or for few people, there might be two rolls also. So we have to transplant the grafts in such a direction that it resembles your roll pattern. So it is always coverage that we are focusing, it's not the density. And we cannot give you a very high density in the frontal area because the donor is not that supportive sometimes. So those are the limitations of doing a crown area transplant. So the picture is halfway through the transplant. The half is already being transplanted and the half is remaining. So the roll pattern is clearly seen, and there is a little mid scalp coverage that I have done, and then the roll part is pending. So that this typical roll we can see where the slits are seen dyed and the mid scalp area is covered. So this is how the transplant goes on.